Geropsychiatric nurses treat patients from all walks of life throughout our country. Older persons with serious mental illness represent an increasingly diverse population. By 2030, the population of older persons in racial and ethnic minority groups will increase by 125% to 20.2 million people. Geriatric mental health disparities will also increase. The Healthy People 2020 document defines health disparities clearly as health differences due to socio-economic factors. Obstacles to good health stem from characteristics related but not limited to race, religion, gender, sexual orientation, mental health, and even cognitive, sensory, or physical disability. The same outcomes are true for geriatric mental health. When compared to the rest of the population, geriatric mental health disparities include differences in prevalence and incidence rates of mental illness, as well as morbidity and mortality rates. Knowledge of mental health disparities is central to your practice. As an advanced practice nurse, you have likely seen more than your fair share of barriers to effective health. Social and economic inequalities contribute to stigma, poor outcomes in geriatric mental health, and decreased quality of life and well-being. Geropsychiatric healthcare professionals are first-line advocates for those experiencing mental health disparities. The social determinants associated with geriatric mental illness are factors that shape the course of aging, mental health, and patient well-being. The 2012 National Healthcare Disparities Report states that healthcare quality and access are suboptimal, especially for minority and low-income groups. Access is getting worse, and disparities are not changing. You can make a difference. To learn more about mental health disparities in older persons with mental illness, click on the following link to the continuing education module, Health Disparities in Geropsychiatric Nursing. A video and the latest information on geriatric mental health disparities is included in this module. This continuing education module represents one component of the Geropsychiatric Nursing Initiative to provide online learning in mental health and aging for advanced practice registered nurses and other graduate-prepared nurses and nursing students. This module was made possible through the generous support from the Geropsychiatric Nursing Initiative, a partnership of the National Hartford Center of Gerontological Nursing Excellence, the Hartford Institute for Geriatric Nursing, and the American Association of Colleges of Nursing.